Hey, Dr. Lindsey and Wendy here. Let me talk to you a little bit about our philosophy on rhinoplasty or nose jobs. Typically, we do cosmetic rhinoplasties at a surgery center with you under a general anesthesia performed by a real anesthesiologist. And a typical first time around nose for me takes somewhere between 55 minutes and an hour and a half. Reading noses are certainly more complex. In general, there are two ways to do rhinoplasties. One is called a closed rhinoplasty, where there's no cuts on the skin. And the other approach is called an open rhinoplasty, where a little cut is made on this piece of skin. And I do them all that way. And I do them all that way because it's much easier to see what you're doing, and because in, I don't know, 600 or 700 of noses that we've opened, we haven't had any real significant scar issues in this area. Wendy, show your nose. Put your nose in. So I did Wendy's nose how many years ago?
Say 8 or 9.
And the little line is right there.
Mm-hmm.
So we do a nose. We meet you in the office and we discuss what your goals are and determine whether you have a functional issue or it's just a cosmetic issue. And a lot of people come in and think that they can get insurance to pay for a rhinoplasty. That's very difficult to do. Next is, if you have a large nose and you can't breathe well through it and you're going to try to make it smaller, you may well make your nose breathing much worse. So you need to be conservative and talk to your doctor before you start down that route. By and large, with rhinoplasties done by me, we do a computer simulation as a guide, not guarantee of probable results, and then we have a picture book that shows the number of rhinoplasties that we've done, and we talk about all the major risks, limitations. By and large, the biggest one is the industry standard for rhinoplasty is that 9 to 15% of patients are unhappy with the results, no matter who does it. And we're significantly below that standard, but still, it's really important for you as a rhinoplasty shopper to make sure you know what your goals are and that they're in match with the surgeon that you're going to go to, and make sure you've looked at noses that doctor has done so that you know you're on the right track. When we do a rhinoplasty at the surgery center, you go all the way to sleep. Everything gets numbed up. We lift up the skin through this little incision and do the tip work and the dorsum work. Sometimes that involves breaking the nose, which is not really breaking the nose like with a fist, but rather making small bony cuts with a sharp osteotome. And then putting things back where they need to be with suture fixation, and then put on an external splint that stays on for a few days. I do not pack noses, but we put a little dissolvable pack that stays in a day or so. If it's still there the next day, we just pull it out. It's roughly the size of a peanut M&M, but I don't pack noses. And by and large, for females, the girl patients typically take 1 to 3 pain pills total, no matter what you do to their nose. And the male patients take a lot more. It's just, I think, yeah. And the same is true with all of our surgeries. Females take less pain pills than males. When you have a rhinoplasty, it's important not to have planned exertional activities or contact sports for a few months. I can't tell you how many people we see roughly a month before they go off to college on an athletics scholarship and they want to get their nose done. And I typically refuse to do that. I think it's going to be a disaster down the road. So on the topic of rhinoplasties, let's go through a few examples. Here's a couple befores and afters. Befores on the left side of the page and afters on the right side. And you'll see, I mean, these are unremarkable looking noses afterwards.
Yes.
I think that the best nose is a nose that does not call attention to itself, meaning that the nose isn't too pointy, isn't too pokey, isn't too...
Yeah, that it's not knows what you had it done.
Yeah.
Just looks that it belongs there.
So these are a few of our cases. So Winnie brought up that we should talk about expectation management. I'm completely into that, and I think that's the most important part of your initial and your secondary consultation, is that you know what I can offer you and what I can and can't do. You can simulate virtually anything on that silly computer, but you may not be able to pull it off in real life. For example, the thickness of the nose skin is a key component. You have very thick nose skin.
Yeah.
You simply could work on that nose for a million years and you would never get a refined nasal tip like some of these French models.
Yes, it's the people can't tell I had my nose done. It doesn't look like a done rhinoplasty. I think it matches my face. And when people see me, people that known me before, they see a difference, but it's not, they don't say, oh, you had your nose done. And then, it's like, oh, and they look at it, and then some might think she could have it more pointy or more, but I do not have that skin, right?
And
we talked about that.
And then you got to watch out if you get a pinched nose. I mean, those are things that are very difficult to fix. And so, by and large, I'm a conservative surgeon in all the cases we do. We've done plenty of these things, and if you're interested and like to talk to Wendy or me, please give us a call. Thanks.